an emergency? What is the proper way to handle such a situation? What first aid advice, if any, should you give to the pet owner? These are some of the questions we will explore in this program on emergency care for animals. This particular program will focus primarily on situations that have not yet arrived at the veterinary clinic or veterinary emergency clinic. Your knowledge and advice during this time will likely save the lives of countless pets. The management of the patient once they have arrived at the hospital is the focus of future programs. Be aware that the information conveyed in this program is limited and must be combined with input from your veterinarian in order to be applicable to the many dynamic situations you will encounter. The first area we will focus on is that of discerning whether or not a situation is a legitimate emergency. This can be quite a challenge when dealing with emotionally charged pet owners. Their response to seeing their beloved pet in a compromised situation may look worse to the owner than it really is. It will be difficult for you to really know how serious their pet's emergency is over a telephone line. This program is not intended to provide the owner with home remedies, but rather critical stabilizing instructions necessary prior to getting veterinary assistance. It is very important that you do not attempt to diagnose the problem or attempt to convince the owner that there is nothing to worry about. If you talk them out of getting emergency care and their pet dies, you are potentially liable for their pet's death. It is always better to provide information to the pet owner and leave it up to them whether they wish to have their pet seen by a veterinarian or not. Encourage anyone who feels they have a legitimate emergency situation to seek emergency care, either with your hospital or a veterinary emergency clinic. At other times, you may recognize an emergency condition that the owner is not fully aware of. At these times, you will really make an impact in saving an animal's life. This program will limit its focus to 12 of the most common veterinary emergencies. Hopefully, you will be sensitized to these and other situations and be able to properly direct pet owners to seek additional immediate veterinary attention when it's indicated. With each situation, we will provide some first aid recommendations that you can offer the pet owner that may make a significant difference in saving the life of a pet. The 12 situations are unconscious or very depressed animals, trauma, bleeding, labored breathing, inability to urinate or defecate, bloat or distended abdomen, poisoning, heat stroke, hypothermia, diarrhea and vomiting, dystocia or birthing problem, and seizures. We will begin with a brief discussion on transporting injured animals. Improper transporting may lead to someone getting bit or the animal's injuries becoming more severe. Animals that are in pain or that have been traumatized are not likely to respond as they might under normal circumstances. Picking them up or even touching them may cause them enough pain that they may even attempt to bite their owners. This is often difficult for the pet owner to understand. Therefore, precautions must be taken to assure the dog or cat does not further injure themselves or the person transporting them. Preventing an injured dog from biting is our first concern. The injured dog that may be in pain should be muzzled before they are moved. This is a good precaution to recommend with any injured dog prior to transport, except those that are having difficulty breathing or have recently vomited. A leash can be wrapped around the nose several times to fabricate a temporary muzzle. Muzzles can also be fabricated from many household items, such as a 3 or 4 foot rope, pantyhose, a long shoestring, or even twine. Have the person transporting the pet tie a large, loose slip knot in the center of the rope. The opening should be large enough to easily slip over the dog's nose. With their hands at a safe distance from the mouth, maneuver the loose knot over the nose. Quickly pull the ends, snugging the knot up tight. Maintaining tension on both ends will prevent the dog from biting or pulling their nose from the muzzle. While maintaining tension, cross both ends under the nose and then tie them behind the head. This will help to prevent the muzzle from slipping off the nose. Another option when a muzzle is not practical is to use a large, thick blanket and pick up the pet with the blanket enveloping the head and body. This works especially well with cats or animals that are not easily muzzled. Be sure the blanket is thick enough to prevent teeth and claws from penetrating the blanket. Animals that appear to have been severely traumatized may have internal fractures or spinal injuries. These animals should be moved very carefully, paying attention not to make the injuries worse from moving them. If they are not able to stand or walk, it may be best to immobilize them onto a board with duct tape. Be sure the person transporting the pet knows that excessive taping around the chest area may affect an animal's ability to breathe. A sheet, towel, or blanket can also be used to carry an injured animal. Sliding the animal onto the blanket will enable 2 people to carry the animal on this makeshift stretcher. Just as with muzzling, animals that have a difficult time breathing should be kept in a position where they can continue to breathe comfortably. This is often accomplished with the pet in an upright position on its chest. Cats should always be transported in a box or carrier when possible. A box or carrier is also ideal for injured small dogs, birds, or other pets. Utilizing these methods, encourage the person transporting the animal to drive carefully without speeding. Be sure they know exactly where they are going and inquire as to their expected arrival time. A second person assisting with transporting the pet is very beneficial, as this allows one person to concentrate on driving while the other person concentrates on controlling the injured animal. If your hospital or clinic is not equipped to handle after-hour emergencies, you may be instructed to refer the emergency patient to one of these facilities. These facilities are staffed and equipped to specifically handle emergency cases. A well-equipped facility will likely possess state-of-the-art emergency care equipment, such as supplemental oxygen, high-tech diagnostic equipment, incubators, and resuscitation equipment. Become familiar with or go visit your emergency clinic so you will be able to recommend with confidence the emergency clinic you are recommending to your clients. Administering treatment to these emergency patients as quickly as possible is critical. Notify the veterinarian that a significant emergency case is coming in as soon as you find out. They will likely want to start preparations or arrange their schedule so they can devote their undivided attention to this traumatized patient. If your hospital is not prepared to handle the time commitment of an emergency, you may want to consider referring these patients to another hospital or daytime emergency clinic. When these patients arrive at your hospital, you need to make them your top priority. This may mean having a gurney or stretcher ready, positioned by the front door prior to their arrival. They should be taken to an area of the hospital where they can receive immediate medical attention, such as the treatment room. Every minute makes a difference when saving the life of a badly traumatized animal.